Hey, hello, good morning, everybody. Good afternoon for some of you. Good evening for others. I know people from all over the world are attending this live session today. So, can you tell me where are you attending from? Which part of the world are you? I'm glad that I'm seeing some people here. I'm recognizing some names already. And I know some of you watch my videos regularly and post comments. So I know some of you from the regular comments. So thank you so much for attending today. I will be talking today about the new World Health Organization's guideline for the management of chronic primary low back pain. So important. This topic is so important and because chronic primary low back pain affects a lot of people. So I'll tell you how excited I am about this guideline. I'm also going to tell you what I am surprised by some of the recommendations in this guideline. And the impact that this guideline will have will be immense. Because as you all know, the World Health Organization, WHO, producing a guideline for the management of a condition, a disease, a problem, the whole world will pay attention and the whole world will follow these recommendations. That's what we hope. But I'm here to tell you some things that I disagree with this guideline, and that's okay. I think not the whole world will agree with these recommendations that the WHO did, and that's fine. I think I was not involved in the development of this guideline, but I had been involved in many other guidelines in my life. So I know how much work is involved in doing this guideline. The guideline was released 2 days ago on Thursday, December 7th, and I still did not have time to read all the, how many pages? 274 pages. Yeah, it's almost like reading a book in 2 days. It's very, very difficult, but I've been looking and studying these recommendations and trying to see, do they make sense? Are they going to help people with chronic pain? Are they going to be followed? These recommendations, are they going to be easy to be followed or difficult? Because some parts of the world, some recommendations will be easy to be followed, but in other parts will be really hard. And I think the WHO should be commended by all the efforts that they did in putting this guideline together. It was, I can only think about, because I've done guidelines in my life and I know how much work is involved, and this is a lot of work. So congratulations to the WHO for putting this guideline out 2 days ago, and for the team that worked really hard. A lot of teams, not only one team, but they had multiple teams around the world doing systematic reviews of clinical trials, randomized trials to come up with this recommendation. So it was a lot of work. I know a lot of the names, many of the people involved in this guideline. I know them personally, not only from Canada, but I know them from other countries, and I know they're very competent. I know these people that were involved in producing this guideline. I know they're competent, very serious. So I have a lot of confidence that this guideline will do justice to the treatments of chronic primary low back pain. But as I said to you, there are some things in this guideline that I am frustrated. I am annoyed that they wrote these recommendations for some of the therapies that I think we need them to use. We need to use them for chronic primary low back pain. So let me see who is here. So I see here some people. Where are you attending this live session? Can you tell me where are you in the world? I like to see, where are you watching from? Is this morning for you? Is this afternoon? Is this evening for you? From Sweden, New York. Wow. So people from one side of the Atlantic and another side of the Atlantic. Thank you so much for coming today. So let's start. Let's get started. I'm going to put some links, and I'm going to copy 7 a.m. in Texas. Thank you, Rogelio, for waking up early to participate in this live. Someone just here around, Toronto. That's great. And Florida, Nigeria, Italy, Waterloo, Ontario, USA, New Jersey. Thank you so much for coming today. So you guys are amazing. Yeah, so let's start. I will tell you first what is the topic of the guidelines, so then you understand the impact of this. Someone from India, wow, Sweden, you're very, very welcome to participate here. Thank you so much. Okay, so first of all, what is a guideline? So when we say a clinical practice guideline, what does it mean? This means that a clinical practice guideline is a document produced by a group of clinicians and experts in research and people who see patients. And also, in this guideline, they involved people who live with chronic back pain. And I know some of these people, some of them are from Canada. And so they involve, a lot of stakeholders, a lot of people in the development of this guideline. And then a guideline is also supposed to be based on high quality scientific evidence. And usually this comes from clinical trials, but also they have a lot of evidence produced by observational studies, because many of the recommendations need to take into account the negative effects, the adverse effects, the side effects of these interventions that they are recommending. And this rarely can be studied in randomized trials. So we do need to look at observational studies that observe a population through a period of time to see if there are complications or side effects. So they did a good job, and the systematic reviews, it's a systematic method of finding all this evidence. So they did all of that. And then a guideline, especially one produced by the World Health Organization, is very important because you don't want to be biased, you don't want to be influenced by pharmaceutical industry, you don't want to be influenced by economic, financial incentives. So the WHO is kind of independent, and their recommendations are not biased by one stakeholder or another. The other important thing is that this guideline is supposed to be applied to the whole globe. Sometimes the guidelines that I participated, they were Canadian guidelines. So we made sure that the guidelines were applicable to Canadian population, but not this one. The one by the WHO is supposed to be applicable, relevant to everyone living on Earth. and this means a lot of countries with differences in the healthcare system, in differences on what they apply, what they have available, the cultural norms, the social norms, the education. So it is really complicated to do a guideline for the whole world. That's why I'm so excited about this new guideline. And the other thing that they say here in this guideline that is so important is that it is to treat, it's a guideline for non-surgical management. So they only looked at things that are not surgery. So you're not going to be seeing anything here that is related to surgery. And the other thing that is important is that this guideline is for chronic primary low back pain. So what is that? Okay. If you watch my videos, you have seen me talking about this all the time, because chronic primary low back pain is the new name. Chronic primary, I'll explain to you what it is, because the International Classification of Diseases, which is part of the WHO, now classifies chronic pain. Since the 11th revision of the ICD, International Classification of Diseases, we now have chronic pain that is primary and chronic pain that is secondary. And this only applies to chronic primary pain and only low back pain. So low back pain is pain in the lower back area, lumbago. So this is only applicable to the low back pain area, which, by the way, low back pain, chronic low back pain is the number one cause of pain, chronic pain in the world. It's a big cause of disability. And they even have numbers here. They say that chronic primary low back pain affects 90%, is 90% of the chronic low back pain presentations in primary care. So of all the chronic low back pains, 90% is primary. So what is the difference between primary and secondary? I think this is really important for you to understand, because these recommendations do not apply if your low back pain is secondary low back pain. So primary low back pain is the one, and they have the definition in the guideline, is the one that is pain for more than 3 months, and it's not due to any underlying disease or other condition. So this is what we called nociplastic pain. This is what we call the pain from central sensitization. This is what we called remember the 3 types of pain. I have a video in my channel that I talk about the 3 types of pain: nociceptive, neuropathic, nociplastic. So nociplastic pain is the type of primary pain. So this guideline only applies to people that have primary chronic pain. Now, if your back pain, if you have low back pain, chronic low back pain that is caused by nociceptive or neuropathic, these recommendations do not apply to you. Okay, clear? Okay, so if you don't know the difference between nociceptive, neuropathic, nociplastic, go to my channel. I have other videos. If you are a healthcare provider, a physician, a pharmacist, physiotherapist, nurse, and you want to learn more about the difference between the 3 pains, what is nociplastic pain, I'm preparing a course, an online course. Go to my website, and I'll type here my website. It is maybe my manager can type that. It's www.drandreafurlan.com. And there you're going to find a page that I have online courses, and I am preparing a course for healthcare professionals. If you are a clinician and you want to learn more about this type of primary chronic pain, nociplastic pain, I'm preparing a course for you. I hope to release that course in the new year. Okay, so let's talk about, now that you know, this guideline is only applicable to chronic primary low back pain in adults, including older adults. That's another thing that I like about this guideline. They did a really good job including older adults in this guideline, because we do have a lot of older seniors who have chronic back pain, and sometimes they are excluded from clinical guidelines. And in this guideline, they included, and also you are going to see that some of the recommendations they make, they say, well, this is not good for older adults, or this includes older adults. So they made a really good point in explaining when they have included, when this recommendation applies to older adults or not. Okay, so let me see. Is there any questions so far? Do you have any question about what I just said now? In terms of you didn't understand what I said. Okay, so it looks like we are clear on this. Some people are saying that your low back pain is neuropathy. Yeah, so examples of when your chronic pain is not primary. Some examples I have in my channel. For example, I have a video that I talk about ankylosing spondylitis. So ankylosing spondylitis is a rheumatological inflammatory arthritis of the spine, and the treatment is different. You need to take anti-inflammatory medications. You do need to take, there is some specific biologic medications for ankylosing spondylitis. The exercises are a little different because the spine starts getting rigid. So this is a type of nociceptive chronic low back pain. An example of a chronic neuropathic pain is if the person has a spinal cord problem, if they have spinal stenosis, if they have a neuropathy, and that is causing problems in the nerves of the spine, that is neuropathic pain causing chronic low back pain. Now, if we can't find a nociceptive or neuropathic cause for the low back pain, and the problem is more like a muscle tension, or it's more nociplastic pain, like the alarm system is sensitized, then this is primary chronic pain, which it is 90. Primary chronic pain, nociplastic pain is 90% of all the low back pains. Okay, so the treatment is different because you are not going to treat the spine itself, you're going to treat the pain system. Okay, so let's talk about the recommendations. And the recommendations, they kind of summarize them into 5 groups. And the groups are, the group A includes recommendations about education. Group B, they are recommendations about physical interventions. Group C is about psychological interventions. Group D is about medicines, including traditional medicines and also herbal medicines. And group E is what they call multi-component interventions. Okay, so let's start talking about the educational one. Oh, but before I talk about the recommendations themselves, they they have a way, excuse me. They have a way of giving strength of the recommendations. Excuse me, I think I'm talking too much in the early morning. So they have a way of saying, this is a strong recommendation in favor, this is a conditional recommendation in favor, or this is a strong recommendation against, or this is a conditional recommendation against, or we are not making any recommendation. So let me explain to you, because this is important. So again, if the guideline says we have a strong recommendation in favor, this means that everybody should be doing this. If the WHO says we have a strong recommendation that everyone in the world should be treating chronic primary low back pain with this intervention, with this therapy, with this treatment, then everybody should be doing. If the WHO says we have a strong recommendation against, because they found evidence that something is really dangerous, the harms outweighs the benefits, then nobody in the world should be doing this. Okay. They may have conditional in favor and conditional against. So what does it mean? Conditional in favor means most people would agree that this is a good thing to do. Okay, conditional in favor means, well, there are, you may not do it, you may not apply this recommendation, it's okay. It's because it's conditional. This is because sometimes they found evidence in favor, there is a little bit of evidence, the benefits are more than the harms. It is a recommendation that it's easy to apply, it's fair, it's available in many parts of the world, and it doesn't have a lot of harms. So that's conditional in favor. And then there are also conditional against. If the WHO says this is a recommendation conditional against, this means that most people would not want to use that because there are more harms than benefits. Sometimes the benefit is so tiny and there are more harms, so they say it's conditional against. But it doesn't mean that if you're using that treatment, that recommendation, you're doing something wrong, okay? Some people will still do that. So let's see which ones they say was in favor, against. Let's start with the Class A recommendations. Those are in educational area. So in the educational recommendations, and I hope I can copy this in the chat. Let me see if I can copy this. This is a conditional recommendation in favor. Let me see. Yeah, I think I can copy this. Let me see if this will work. Because I don't know how I can show you my screen. Okay, so A1, in the group A, They only have one recommendation in the group A, which is structured and standardized education and or advice interventions may be offered as part of care to adults, including older people with chronic primary low back pain. Okay, so what does this mean? This is a conditional in favor. Okay? So again, conditional in favor means they recommend it, but not everybody needs to do that. It's not a strong recommendation in favor. What do they mean by a structured and standardized education and or advice? So I tried to read that in the guidelines. So that is in the 274 page document, and you can download. These are all free. I'll put it at the end of this live. I'll put the link for you to download the whole, if you want to read the whole 274 pages that I've been reading. I'm trying to read in the last 2 days. So what they mean by this structured and standardized education. So they say that educational interventions include things like delivered by a medium, like it could be a verbal, written, or digital education, and in any format, like individual or in group. So I think this is what I'm trying to do in my YouTube channel, because what I'm trying to do in my channel is providing education for people with chronic pain, including chronic low back pain, including chronic primary low back pain. So education about what? So they say education about the topics of the education could be exercises, helping a person to make sense of their chronic primary low back pain experience, adoption of effective self-care strategies to support their concerns, and recovering, overall well-being, pain coping, and ergonomic advice. Okay, so this is I will type here what they mean by typical content. Yeah, and Rosa is saying that I am doing a good job in doing this, because I'm doing what the WHO is recommending, right? So I'm glad that what I'm doing with my channel is included. I'm trying to copy here the recommendation in the chat, so then you can read that. Yeah. So this works because, as I talk a lot about this in my channel, education is the first step to overcome chronic primary low back pain or any kind of chronic pain. And I think the person needs to understand what they have. They need to understand the difference between nociceptive, neuropathic, nociplastic pain. They need to understand self-management, like the 5 M's. I always talk about the 5 M's, the 5 M's of self-management. You need to know your mind interventions that you can apply, your movement, the modalities, the manual interventions, and the medications you can use. So this is all, I think this is good, right? And understanding the kind of pain is part of the treatment. So that is education, and the WHO has this conditional recommendation in favor. Okay, I need to go faster because there are so many recommendations, and I hope to finish this soon. I don't want to keep you here the whole day. So the next group of recommendations are for group B, is for physical interventions. So now they have conditional recommendations in favor, and I'm going to type here for you what they have in favor. So they have conditional recommendations in favor for structured exercise therapies or programs. They have conditional recommendation in favor of needling therapies. And I need to do a video on my channel about this. This includes acupuncture. I am an acupuncturist. I don't know if I told you this, guys, but I am trained as an acupuncturist. And I'm glad to see that they recommended this in the guideline. There is another conditional recommendation in favor of spinal manipulative therapy, that is a spinal manipulation. And there is a conditional recommendation in favor of massage. So these are all conditional in favor recommendations. Let me see here. Yes. Okay, so these are the ones in this category B, physical interventions, only these ones. Yeah, Rogelio is asking, what is the purpose of needle therapy? Yeah, and Rogelio, that's a good question, because I need to do a video explaining that on my channel about what is the effect of acupuncture. So acupuncture, needling techniques, what they do is actually, because they cause a little bit of stimulation in the pain system, we know there is evidence that when we stick needles in the body, that is creating a stimulus that is registered by the brain, has a painful stimulus. So the brain will respond to that by opening that inner pharmacy that we have in the brain. I have a video about the inner pharmacy. Remember that video? How can we open the doors of that inner pharmacy? And our inner pharmacy that we have in the brainstem produces opioids, potent opioids like endorphins, also releases serotonin, dopamine, and even cannabinoids like anandamide. So acupuncture is a potent way of opening that inner pharmacy. However, that those medications that will be opened by the needle, they will only last a few days. Well, which is better than taking a pill, because if you take an opioid, it may last only 6, 10, 12 hours. And the opioid produced by the needle may last up to 7 days. So one dose a week. But we don't want to be recommending people to do acupuncture, needling once a week for the rest of their life if they have chronic primary low back pain. For me, what I recommend people is you do the needling technique, you alleviate your pain, and then you use that period of pain-free to do your exercises, because the exercise will build up your pain system, will regulate your pain system. You do your mind-body therapies, and we'll talk about the psychological interventions. Okay? Good question. Any other question? Is it true that the body can and will heal itself at certain point? Yeah, Rogelio, that's another good question. Yes, it is true. The body heals. The nociceptive neuropathic pain, they heal. And then the nociplastic pain, we need to retrain the pain system again, how we can return the pain system to normal. And by the way, Rogelio, I don't know if you remember, I published a book, and the step number 1 in my book is retraining your pain system, which is basically how the person can eliminate that nociplastic component. Okay? Okay, but I have to tell you that in the class B of recommendations, there are also recommendations that are conditional against. So I need to tell you that some interventions in this category, the WHO said that they should not be done. So what are the ones? You're welcome, Rogelio. So now the recommendations that there are conditional against. So I'm going to type here the recommendations in this category, the physical interventions that the WHO says, no, but it's conditional. They don't have any recommendation here that is a strong against. Again, it's conditional. Conditional against means it's not a good idea to do, but it's not wrong if you do it. But be careful, because if you do it, there might be more harms than benefits. So what are they? The first one that there is conditional recommendation against is traction. Okay, traction. The second one that is conditional recommendation against is therapeutic ultrasound. So that means the ultrasound that the physiotherapists, they have in their office, and they apply that ultrasound that heats the muscles, because therapeutic ultrasound is a kind of a deep heat. So they found that the benefits are tiny, very small, and there are harms associated with therapeutic ultrasound. Another one, and this is the one that I don't like I disagree with this. They said conditional recommendation against, and I would tell you why I am frustrated, at least frustrated that they said conditional recommendation against TENS. I think, and I have a video about TENS, and I think TENS is a good modality to retrain the pain system, because TENS is an electrical stimulation that trains the spinal cord, the dorsal horn, where central sensation happens, to modulate that dorsal horn, because TENS is an electrical impulse that will be transferred to the spinal cord, where central sensitization happens, and then it can block the painful stimulation that goes to the brain. So I'm frustrated because I like to recommend TENS to my people with chronic low back pain, not for the rest of their life. Again, I recommend them to do this, to buy a machine, apply at home, so they can have some period of pain-free relief. It doesn't have side effects, unless if the person has any cardiac arrhythmia or epilepsy. They should not be using TENS. But if they don't have that, then applying the TENS in the low back area can stimulate those endorphins the same way that needling does. So this is one that I don't like. This is one that I think should be revised, but I don't think there will be a revision of this guideline. Anyways, so another one that is against, again, conditional recommendation against, is traction. Lumbar braces, belts, and supports should not be used. So I know some people like to use belts and corsets. That is not recommended. And also traction. Traction, those devices that pull the person to do traction, they are, actually the effects are very small. I know a lot of people swear when they do traction, they feel a lot of benefit, but every evidence shows against traction, showing that actually doing nothing, or even a sham traction, which is a fake kind of traction, is it's not good. Okay, there's a question there. What if I have pieces of metal on my lower back? Well, it's good if you talk to that is Disha. Disha, it's good if you talk to a physiotherapist. Depends on where the metals are. I don't know where they are, but I know if there are metals implanted in any part of the body, you should not be doing deep ultrasound, like the therapeutic ultrasound, because they can heat very quickly and burn the tissues around. For TENS, it really depends if the metals are related to, for example, a spinal cord stimulator, so the TENS could interfere with the current. But other than that, it depends really where the metal is and where the pads of the TENS will be applied. So talk to your physiotherapist. They can guide you where to put the TENS pads. I hope, but that depends on where the pads of the TENS will be applied. Okay, so those are the recommendations in this category of physical interventions. Those are the recommendations in favor and recommendations against. They have another here, but it's not a recommendation, it's just a good clinical practice, so I'll not talk about that. Okay, let's go to the psychological interventions. That's group C, because I will spend a lot of time on the medicines. They have very interesting recommendations in the medicines, and I want to get there. So group C is psychological interventions, group D will be medicines, and group E will be multi-component interventions. Okay, so now let's talk about, so group C, this is a psychological interventions. What they have here is interesting, very, very interesting. They have 1, 2 recommendations in favor, conditional. That's it. 2 conditional recommendations in favor. And I am surprised by this one. So this one is called operant therapy. So let me put it here. Conditional in favor is operant therapy, and I will explain to you what this is in a minute. And the second one that they have in favor, conditional recommendation in favor for chronic primary low back pain is CBT. Okay, so so operant therapy and CBT, 2 conditional recommendations in favor. And then they had other interventions like respondent therapy, cognitive therapy alone, and mindfulness-based stress reduction. But for those 3 things, they say no recommendation was made because there was low certainty evidence. The balance between the benefits and harms is so equivocal that a recommendation could not be made. Unfortunately, so then they did not make any recommendations for respondent therapy, cognitive therapy alone without the CBT, and mindfulness-based stress reduction. So again, I'm frustrated because mindfulness-based stress reduction therapy, they did not make any recommendation. I think this is a very important recommendation. I think this is a very no harmful recommendation. But I guess the problem was that they did not find trials. They did not find evidence to support this. So in the absence of trials, clinical trials of this kind of recommendation, they can't say anything. So actually, this is a fault of the research community, that if we want people to do mindfulness-based stress reduction therapy for chronic primary low back pain, we do need to do the studies. More research is needed. So we need your help. I'm a researcher, and we need your help to help us to get more funding. Like the agencies that fund research, sometimes they are not excited about funding research for low back pain, especially chronic back pain. So wherever you live, please, can you tell your government, your policymakers, and people who have access to funds, like sometimes government agencies, they fund research. They need to be aware that low back pain, chronic low back pain is a big problem. It affects, we know here the WHO was saying in the introduction of this guideline, the WHO recognizes here that the problem is huge. They say here I think it's in the executive summary, that low back pain is very common, experienced by most people across their life course. So this means almost every individual in the world will have low back pain at some point in their life. It affects young people, adults, older people, and the disability related to this is very disproportional to older people. So older people with chronic back pain, low back pain is mainly where the disability is. And they say that 2/3 of people who experience an episode of acute, listen to this, this is really important. 2/3, so 2 in 3 people who experience an episode of acute low back pain. Acute low back pain is that pain that, just started. You didn't have low back pain. Now, you woke up with that low back pain. That's an acute episode. Acute back pain means pain every day that is lasting a couple of days, weeks, but less than 3 months. Because once it reaches every day, constant, persistent for 3 months or more, that is chronic. They say that 2/3, 2 in 3 people who have an episode of acute low back pain will continue to experience symptoms that persist for more than 1 year. often in an up and down pattern. Did you listen to this? So 2/3, 2 in 3 of people who have acute low back pain will develop chronic back pain. They will continue having episodes of back pain on and off up to a year. It's a huge problem because now if a person has low back pain and 90%, and again, they say 90% of these are primary low back pain, which is there's no nociceptive cause. It's not neuropathic. It's nociplastic. The problem is in the pain system itself. It's a primary low back pain. It's not secondary low back pain. I have another video in my channel. I just released this, I think, a couple of weeks ago. What are the serious causes of low back pain? Okay, so when a low back pain is not primary, when a low back pain, acute or chronic, is a serious problem, it's a neurological or fracture or an inflammation or infection or a tumor. So watch that video if you want to learn more, and your doctor should be familiar with those things, because how do we know if a low back pain is serious or not? Usually by asking some questions and examining the patient is enough for us to know if this low back pain is primary or secondary. Rarely we need to order an X-ray, CT scan, or MRI. Just by talking to the patient and examining the patient is sufficient, more than sufficient, to find out if this pain is primary, secondary, serious or not, okay? That's what I'm trying to do with my channel. I'm trying to teach people who have pain, but also healthcare professionals. So help me to get that message out. Casey said, WHO neglects older adults in this. Which one, Casey? Which recommendation do you think that, because this guideline, Casey, is, I was telling this earlier, it includes older adults. Actually, some of the recommendations they make here, they say including people with older adults, not including people with older adults. I suggest you to take a look at the link of the 274 pages, because you will see they did a good job talking about older adults, not only adults, but older adults in this guideline. So I'm proud that they did that, and I'm very happy that they did that. Okay. So can we keep going? Yeah, now let's talk about medicines, drugs, medications. They have a lot of recommendations here. So let's changing. Yeah, you're welcome, Casey. So medicines. So group D, medicines. Here it is. They have conditional recommendations in favor. Let's talk about those first. So, and again, I have a lot of problems with this section. You will see me ranting here, because this recommendation in favor. So recommendations in favor. First one, I don't agree with this one, but anyways. Non-steroidal anti-inflammatory drugs, NSAIDs. I have a video about NSAIDs in my channel, and you will see, like, if we're talking about nociplastic pain, like chronic primary low back pain is nociplastic pain, why are we giving NSAIDs? NSAIDs are excellent, very good for nociceptive pain, for inflammatory low back pain. I don't think they do anything for nociplastic pain. I don't know why they recommended this. Really, I don't understand. But anyways, they did it. I would say because they found some evidence that justified this. Actually, the evidence for drugs is mainly paid by pharmaceutical industry. Like, it's really rare that you have a randomized control trial of a drug and it was done without funds from the pharmaceutical industry. So, do they have an interest in show that their drug work? Yes, they do. Do they design the clinical trials in a way that make more likely that the results will be positive? Yes. If they have a lot of resources and money and funds, it's easy to include hundreds or thousands of people in a randomized trial. Yes. And the bigger the randomized trial is, the bigger your chances of finding some positive results. So NSAIDs are included as a conditional recommendation in favor. I disagree because for chronic primary pain, I don't see a point. Anti-inflammatories are not going to fix the pain system. So maybe what I would say is if the person wants to use the NSAIDs, and these are, for example, examples of NSAIDs are the ibuprofen, naproxen, diclofenac, and other medications are in the class of acetylsalicylic acid, aspirin. I didn't want to use the brand name. Celecoxib. So those medications, there are many medications around the world with different names. They may cause problems in the stomach. They may raise the blood pressure. They may cause heart attack. They may cause kidney insufficiency if used long term. So I would say use just for a few days, but we're talking about chronic primary low back pain. This means the person has chronic pain in the back area for years, months or years. What difference is it going to make if they use 5, 7, 10 days? Anyways, but the WHO said it's okay to use. So that's a conditional recommendation in favor. That's it. That's the only one. We have a herbal. I will come to the herbal medicines that the WHO recommended. But now we have a long list that the WHO says conditional recommendation against. They don't have any strong recommendation against in this category. They have a long list of conditional recommendations against. Okay, here they come. Here they come. Guess what is the first one? So this should not be used. Opioid analgesics should not. Well, I should not say should not. I would say because it's a conditional recommendation, it is okay to use in some situations, but in the majority of cases, WHO recommends against. This is because the harms are much bigger than the benefits, and I explain this in my videos in my channel. I recommend. Someone is asking, Ivan is asking about capsaicin. I'm coming there, Ivan. Wait a few minutes. Opioids for chronic primary pain. Again, for nociplastic pain, if you watch my videos, you will see that nociplastic pain gets worse with opioids. Opioids are great if the chronic back pain is caused by nociceptive only, purely nociceptive, which is very rare, or purely neuropathic, which is again very rare. 90% of people who have chronic back pain have a nociplastic pain. It's a chronic primary pain. And if you give opioids to these people, you're going to put gasoline on the fire. So I agree with this. I think this should be strong against, but they did conditional against. Okay. The next one that is conditional against, and again, I disagree with this one. It is serotonin, noradrenaline, reuptake inhibitors, SNRIs, antidepressants. I disagree with this one. These are medications like duloxetine and venlafaxine. I have a video on my channel that I talk about duloxetine. And so the thing here is these antidepressants, they kind of help to regulate the pain system. Remember, we have the pain system in our body that is deregulated. That's what nociplastic pain is. And there is a lack of the descending inhibitory pathways. I explained this in my book here. I have a figure in my book that I explain what is the ascending, the bottom up. These are the ascending pathways. And then I have the descending pathways that are, starting from the brain, they come down to the periphery and they block the pain to regulate the pain system. And we know that this is dependent on serotonin, and SNRIs, they increase serotonin and noradrenaline in some parts of the brain, helping that descending inhibitory pathway. So I do use that a lot, but the guideline here says conditional against. So I'm frustrated that this is conditional against. Again, it doesn't say, it's not strong against, but it's conditional against. Okay, here we have another one this is also conditional recommendation against tricyclic antidepressants. And there is a comment there, not in favor of meds for lifelong. Yeah. Yes. Yeah, me too. I agree with you, Susan, that I'm not in favor of lifelong using of medications for chronic primary low back pain. But when I get a person coming to me and they are very depressed, very anxious, they're not sleeping, and they have nociplastic low back pain, I do need to help them to get into a stable system that for a short period of time, let's say for 6 months, we're going to use duloxetine and you will start sleeping better, or even tricyclic antidepressants, which, again, the WHO recommended conditional against. I use some TCAs when my patients are not sleeping well, when they are depressed, although they are antidepressants, but the dose that I'm using are not antidepressant doses. And I find them useful to help them relax at night. Instead of using muscle relaxants, I use tricyclic antidepressants at night. But again, the WHO said, no TCAs, it's a conditional recommendation against. Another one that is a conditional recommendation against is anticonvulsants. And I use anticonvulsants for chronic pain, especially neuropathic pain. I have videos on my channel about gabapentin, pregabalin, when to use, how to use. I understand that for chronic primary low back pain might be strange, but they help if there is some component of especially if the pain is mixed, neuropathic and nociplastic, so secondary and primary pain. I like to use the anticonvulsants. But here, they are talking only about primary chronic pain, so I understand they don't make a lot of sense. Another one that the WHO is conditional against, I told you there is a long list of conditional against, is skeletal muscle relaxants. And Linda is saying, well, I don't think Big Pharma controls WHO. Well, Linda, you're seeing here that probably not. What you are saying is not true, because if this was true, WHO would make a lot of recommendations in favor of these drugs, opioids, SNRIs, TCAs, anticonvulsants, skeletal muscle relaxants. Big Pharma might be really crazy and mad right now at the WHO because of this. So this shows that the WHO had the guts to say against opioids, against SNRIs, because in muscle relaxants, these medications are prescribed a lot in the world. So for WHO to have the guts to say recommendation against, this shows how much they are not controlled by pharma. Another one that is against is glucocorticoids, which, oh my God, that is used a lot in the world. And I would say I don't see any point in using glucocorticoids. These are steroids, cortisone, prednisone. I don't agree by using these medications at all for chronic low back pain, including chronic primary low back pain. But I know a lot of people use this because, again, people feel better. So if the patient feels better, oh, it must be doing something. But let me tell you one thing. Glucocorticoids are excellent for everything. Like in medicine, we say, when you don't know how to treat something, we have a saying, when you don't know how to treat, just give them glucocorticoids because it's going to make them better. Well, just because glucocorticoids activate a lot of pathways in the body, it interferes with the endocrine system, the neurological system, it's a potent anti-inflammatory, but it disrupts a lot of other systems and has a lot of serious side effects. This doesn't mean that we should be using for everybody. Just because they feel better for a couple of hours or days or weeks, it's not treating the disease. Again, we should not be doing something just because a person feels better. We should be thinking about what is the disease that they have and treat the disease. Okay, so I agree with this one, that glucocorticoids should not be used. Bom dia, Didi. Yeah, you're in Montreal, Quebec, but you're speaking Portuguese. Welcome here. Another one that the WHO recommends is a conditional recommendation against is this one here. It's injectable local anesthetics. Should not be used as part of routine care, including older people for chronic low back pain. Okay, I do some, injections of local anesthetics. I do trigger point injections, and I sometimes recommend my patients to do facet blocks, which include local anesthetics. So this should be taken into consideration. Again, what is that we are trying to treat? Like, in my opinion, if they have myofascial trigger points that is sensitizing the pain system, that is causing, this primary chronic pain, and primary chronic pain, if it is localized to the low back area, can spread to the body and become fibromyalgia, because fibromyalgia is chronic primary pain that is widespread all over the body. So we should be really careful how we are treating this, because if you're doing local injections with local anesthetics, you should not be treating fibromyalgia with that, because it doesn't make sense. But if the pain is not widespread and they have local trigger points, then I would say I do that. Although here in the WHO, they say not as routine care. And I understand, you shouldn't be going for local injections, like injections every week or every 2 weeks. That doesn't really make any sense. You do the injection, and I do the injection every 3-4 months. You do the injection, and then you feel better for a few weeks, months, or that trigger point is treated. And then you use that period that you are feeling better to do your exercises, your mind exercises, your physical exercises, to engage in a walking exercise program, right? So this is what we should be doing here. Okay, so the next one that they have here, and they do, so these are the against ones. Okay, yeah, they did not make any recommendations. So no recommendations made for paracetamol or acetaminophen, because they could not find evidence for chronic pain. They found evidence for acute low back pain that showed that paracetamol, acetaminophen was not different from placebo. And they say, well, if for acute low back pain it's not different from placebo, maybe for chronic low back pain it's also not different. But because they did not find clinical trials, they could not make a recommendation. They also did not make a recommendation for benzodiazepines, because they said there were no trials identified to evaluate the benefits or harms of benzodiazepines in chronic primary low back pain. And also they did not make a recommendation for cannabis or cannabis-related products. Okay, so now let's talk about the herbal medicines. Herbal medicines. I think someone was asking me, Ivan was asking me before, what about herbal medicines? They made a conditional recommendation in favor of only one herbal medicine. So conditional in favor. Drum roll. Do you know what it was? And I don't really agree with this one, but that's fine. It is topical capsaicin. Yeah, that was, I think, Ivan, you were asking about that. Ivan Chandra. Yeah, so the WHO made a conditional recommendation for favor. I have a video about capsaicin on my channel that you can watch. And this is a cream that you apply to the skin. I found really strange that they recommended this for chronic primary low back pain. Again, because chronic primary low back pain is nociplastic pain. Usually the area of chronic pain is really large, and applying this cream to a large area of the body hurts because that cream, it feels like burning in the skin. It doesn't burn the skin, but it feels like burning. The person has to wear gloves when they are applying capsaicin. So put gloves and then apply to the back, and they have to apply 3 times a day for at least 2 weeks to see any benefit. So if you want to learn more about capsaicin, watch my video that I have. So that was the only one of all the herbs. That was the only one that they were in favor. Now they have a conditional recommendation against. I'll tell you what they are in the herbal ones. They recommended against devil's claw. And I know a lot of people use this in many parts of the world. In the naturopath world, they are prescribed this herbal substance, devil's claw, that's the popular name. So the WHO recommends against. And the other one that the WHO, it's a conditional recommendation against, is the willow bark, white willow. Yes, so white willow was recommended against. Again, I'm not a naturopath. I'm not too familiar with this recommendation. Maybe I should invite a naturopath doctor to come to my channel and explain these things. But these are the recommendations that they recommend against. Okay, so these are all about medications and medicines. They have other recommendations, other herbs here that they did not make any recommendation. The topical Brazilian arnica, no recommendation. Ginger, no recommendation. Topical white lily, no recommendation. Topical combination of herbal compress, no recommendation. And topical combination of herbal transdermal diffusional patch, no recommendation. Okay, so let's talk about the last class of interventions for chronic primary low back pain. These are the multi-component interventions. What are they? So they have, there's one recommendation, one intervention that they made a conditional recommendation in favor. So they have conditional in favor, blah, 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 blah. Let's see, drum rolls. Do you know what is this? It is multi-component biopsychosocial care. So what does this mean? They recommend that for people with chronic primary low back pain, the care should be delivered by a multidisciplinary team offered as part of a care for adults, including older adults. So one professional only probably is not going to see the whole picture of the person. That's what they say. If you're only being treated by a doctor, probably you're missing other important parts of your care. If you're only seeing a psychologist, you're also missing important things. If you're only seeing a physiotherapist, you're probably missing other parts. So the team should include people with experience in medicine, nursing, pharmacy, people with experience in mental health, like social workers, psychologists, psychiatrists, counselors, and people with experience in movement and modalities, like physiotherapists, chiropractors, kinesiologists, massage therapists, etc. Okay? So that's the only recommendation that they have in favor, and it's a conditional in favor. They have one against. So recommendation, so this is a conditional against. They only have one conditional against, and that is pharmacological weight management, weight loss. Interesting. They said there's no point in doing a pharmacological weight loss, should not be used as routine care. And they did not have any recommendation about non-pharmacological weight loss. Like, should we recommend people to lose weight if they have chronic low back pain? I think so, because we know, I have a video in my channel that I talk about weight. We know that excess of adipose tissue in our body produces inflammatory substances like cytokines. These are called adipokines. Those inflammatory substances produced by adipose tissue, like fat tissue in our body, produces a low-grade inflammation that is bad for our heart, it's bad for the joints, it's bad for the brain. We know that it accelerates dementia. People may develop dementia early if they have those adipokines, because it's a low inflammation in the body, the whole body. So losing weight, yes, it is recommended, but they say, let's not use medications to do that. Okay, but it's a conditional recommendation. Again, remember, there are conditional recommendations. So these are all the recommendations. You see, they did not make any strong recommendation. There are no strong recommendations in favor or strong recommendations against. So this is what I wanted to spend time with you. I'm sorry that I went a little bit over 1 hour. I was hoping to spend no more than 1 hour. Thank you so much for watching today. I hope you can write your comments, questions. I'll be reading the questions after I finish and try to answer them. And if you have more interest for live sessions like this, please send me suggestions and I can make more live sessions that we can discuss. I can answer your questions. The replay, excuse me. The replay of this live session will be archived in my channel and you can watch there. Remember, this video is not supposed, I'm not here supposed to give you medical advice. If you have any condition like a chronic low back pain, please talk to your doctor. Now you're more informed about the WHO recommendations. You can talk to your doctor about them. You can ask more questions. And I hope my videos are helping you to get more knowledge, education about what is chronic pain and chronic low back pain. So thank you very much for watching today, and I'll see you next time. Bye.